Hey guys, let's talk about taping. As you know, we're going to have to start taping or tying more of our patients. So here's a couple of things you'll need to tape. So as you can see, I have a couple tongue depressors. I like to use just one, but some people like to use two. This is a Kevlar no sting barrier film. It just puts a barrier on the skin to prevent skin tears when you're placing tape on your patient. And then of course, you're going to need a roll of tape. Okay, here you can see I just have my roll of tape and then one tongue depressor. If you want to use two, you can absolutely do that as well. I'm going to first pull off a piece of about 6 inches or so just to use as the piece that will be non-adhesive or non-sticky behind the neck. Next, I'm going to unroll another piece, and this is where I'm going to put my tongue depressor over it so that way it doesn't stick to itself. So I overhang the tongue depressor just a little bit over the edge. That helps it make it a little easier just to unroll it when I need to later. And so I'm going to fold it over itself. Depending on how big your patient is, you can fold it once over, or some people like to fold it twice over if you just need a longer piece. Now I'm going to take my 6-inch piece that I cut earlier and put it on the tape sticky side. It adds a smooth side that we will place underneath the patient's neck, so that way it protects the neck when we slide it under. Then you can just fold it over itself and you are ready to go. Or you can also repeat the same thing I did with the one depressor on the other side of the neck piece, and just repeat that whole process if you prefer. Now I'm going to put on my Kevlar no sting barrier film, and remember, this is just going to help prevent skin tears. You're going to apply it to the upper lip and the cheeks. You want to make sure you wait until that's completely dry before you place your tape. Okay, as you can see, this is how I do it with just the one tongue depressor. If you use 2 tongue depressors, yours will be a little bit longer. With that tape roll not there, it'll have the tongue depressor on either side. Okay, I'm going to take my tongue depressor side and I'm going to slip it underneath the neck. And now that there's no adhesive exposed, it's not going to stick to the hair or neck of the patient. And I'm just going to unroll my tape as much as I need on the other side and make sure that my non-sticky side, the little protectant piece I put under my neck, is kind of centered. And now you can just unfold the side with the tongue depressor. Now that my Kevlar barrier is dry, you'll see a little shiny film, but that's what it's supposed to look like. And now you're ready to tape your patient. Now you can just start bringing your tape around towards the tube. Make sure you're pressing lightly on the skin so that way it's sticking as you go towards your tube. Tear off any extra tape that you don't need. And now you want to start splitting the end. However, you want to make sure that you are not splitting it so far down. You only want it to go right to where your tube sits. Now you could just lay that upper piece of tape along the upper lip, create a courtesy tab if you'd like. You're going to make sure your tube is aligned right to where that split is in the tape, and you're going to wrap it down and around. Make sure you are not crimping off your pilot line. And I'm going to wrap it around. And as I wrap it around, you want to kind of candy cane it up. You don't want to keep it all in the same area as you're wrapping it around. And create a courtesy tab and secure it. Okay, I'm going to unroll my tape as much as I need for the other side. If you used a tongue depressor, then you'll just unfold it. As I wrap it towards the patient's tube, I'm going to make sure again that I'm staying underneath the patient's earlobe, and then I'm pressing down as I go. Tear off any excess that you don't need because it might be quite long. Now you're going to split the tape on this side. You're going to put the tube right where the tape is split, so that way it secures it real nicely. I'm going to wrap it down and around. Again, you want to avoid taping up your pilot balloon. And of course, you're going to have an extra set of hands on here, so I'm just trying to keep my hands out of the way for the video. So you're going to candy cane it up like before, and then you're going to make your courtesy tab. And make sure when you're wrapping it around close to your lip that you're not actually pinching your lip. Some people like to add an extra piece over the top just to make it look a little bit more presentable. This is not necessarily needed, but you can absolutely do it if you'd like it to look a little bit nicer. Okay, so we're all done. This thing is really secure. I am yanking on this thing. It is not going anywhere. He probably is going to need a cervical collar after that, but it's secure.